thanks so much for taking time out to speak about suicide prevention because it ties so well with the Seether interview. Because Sean Morgan was just saying wonderful things about you, so I thought, gosh, wouldn't it be great to have Dr. Dan on and speak more about suicide prevention, especially in September, which is Suicide Prevention Month.
Correct, it is.
You are have a doctorate of psychology.
I do.
And executive director of save.org.
I am.
Okay. Anything else that you would like me to include in your introduction?
I could send you an intro. I'm the managing director of the National Council for Suicide Prevention. I'm also on the board of directors of the International Association for Suicide Prevention. I'm an internationally recognized expert in the topic of suicide prevention. I do training all over the world. I've developed one of the 3 evidence-based programs for suicide prevention in high schools. I developed the best practices for media reporting on suicide, blogging on suicide, reporting on mass shootings. So, I could send you something if you want, and you could read whatever you want as an intro.
You know what? That would be incredible. I would love that. I think it would save me definitely a lot more time and give you a much better introduction.
Sure.
Save.org stands for Suicide Awareness, Voices of Education, which is primarily about suicide prevention and education. And Dr. Dan and Save.org has partnered with the Rise Above Fest, and which is a music festival that aims to raise awareness of suicide prevention and mental illness, which was started by Sean Morgan, who lost his brother Eugene to suicide. So welcome, Dr. Dan, to the Check Ahead podcast. I'm so glad you're here, especially in September, which is Suicide Prevention Month.
Well, thank you. Thanks for having me. Thanks for doing this. We are incredibly honored to have Sean and Seether, the entire band, as supporters of SAVE in our work and our mission. They've been great to work with over many, many years. Sean is a close personal friend of mine and someone who I look up to in the music industry, who really is leading the way of changing the stigma around mental health, definitely the stigma around suicide. So we're really excited about all the things that have happened in the past, looking forward to more great things in the future. It helps us reach an audience that otherwise we never would be able to reach.
Well, I do know that mood disorders can often start very early on. We've had musicians come on saying that they, started having symptoms in elementary school and, on toward their teen years. So it is really important to educate people early. And I wanted to start with something, really important, but also kind of basic, which is, what are some of the facts you could share regarding suicide?
Sure. Well, there's some big numbers and there's some really sad numbers. We lose about 800,000 people a year to suicide. That's one death every 40 seconds somewhere in the world. So this is a major public health crisis. In the United States, the last year we have data from the CDC is in 2018, and we had over 47,000 people. The actual number is 47,344 lives lost to suicide. That means we're losing one American about every 10 minutes. Somewhat more scary for a lot of people is that about every 28 seconds, someone attempts to take their life. Every 28 seconds. And as you just mentioned, this really cuts across the lifespan. We have young people that really struggle with emotions and feelings and their thoughts, and that continues through adolescence, it goes through adulthood, and even to seniors. And suicide cuts across the lifespan. We have young kids, 5, 6, and 8 years old, that are dying by suicide. We have young teenagers, 11, 12, and 13, dying by suicide. Our first real big spike in suicide occurs right after people graduate high school and go into college, so somewhere in that 18 to 20 range. But if we actually look at the numbers of suicide in our country, the largest group of people that we're losing to suicide are adults. Now, we know seniors also die by suicide, and this is a tragedy as well. imagine your grandparents, and for some, your great-grandparents that are dying by suicide. So we know that this really cuts across the lifespan. It happens every day of the year. It happens all over the country, again, around the world, but around the country. And not unlike around the world, in our country, suicide occurs in more rural areas, states where there's fewer access to resources, more access to firearms, less access to therapy. Those kinds of things increase the risk. So states like Montana, Wyoming, Nevada, where it's far more rural, we have more suicides. But that doesn't mean we shouldn't be paying attention to other places. We have suicide in major cities and urbanized areas as well. We also know that more males die by suicide than females, 3 times as often, but females attempt suicide almost 4 times as often. So we know this cuts across ages, it cuts across demographics of where people live, money, what their income is doesn't matter, their gender doesn't matter. We know that both males and females die. We do know that sexual orientation plays into suicide. Now, what we don't know, and this is one of those myths that's out there, is that there's more LGBTQ individuals who die by suicide. And while we believe that to be true, we don't have any real data on that anywhere in the world because sexual orientation isn't captured on death certificates. So we don't really know that to be true. We do know that LGBTQ individuals think about suicide more and they have more attempts at suicide, but deaths we don't know. So we know that this is a really prevalent issue. It is a public health crisis. It has been for decades now, and it's something that we absolutely all need to be a part of.
Well, thank you so much for letting us know about that. You know, the podcast a lot of it is about solutions. And on checkyourheadpodcast.com, we have a list of organizations like save.org and the Suicide Prevention Lifeline and online support groups, especially, you know, now during the pandemic that can be used, even if you're in rural parts of the country, you know, where you feel disconnected from people. There are ways to connect, you know, by phone, by computer. And so we do have a big list for people that are not sure where to turn to.
Yeah, that's great. It's really important. And as technology evolves, that's helping. We have the crisis text line. So we have the National Suicide Prevention Lifeline. I'm on the steering committee for that, and it's a great service for anybody to call. But for those that don't want to talk to somebody or too embarrassed or afraid what they would say or how that would go, they can text. They can text hello to 741-741, and they'll be able to have a texting conversation. You can actually use social media to find groups and support online, whether it's on Facebook or other social media platforms where you can find good resources that can really help you through these crises.
Yes. And the next question is what are some of the warning signs or the behavior of somebody who can be a suicide risk?
So we know that there are risk factors that put people at greater risk of dying by suicide. Some of those risk factors might be family history of mental health issues, family history of chemical health issues, family history of suicide. You yourself might have a history of mental health. Risk factors are if somebody loses their job or gets kicked out of school or has legal problems. These are things that put people at greater risk of suicide. Conversely, we have what's called protective factors. And protective factors are those things that are like buffers. Those are things that help keep us from going down that path. So a protective factor might be, for example, connections to family, connections to faith, connections to your community. All kinds of connections make a difference. If you have good access to medical care and good health care, that's a buffer. So we have these things called risk and protective factors. As you mentioned, we have warning signs. And warning signs are a little different in the sense that these are the things that we know that people that have died by suicide have done in the past prior to their death. The ones that are most important that we pay attention to are, number one, anybody communicating their intent to die. Now, most people don't just come out and say, I'm going to go kill myself tomorrow at this time, at this place, and this is how I'm going to do it. It's often far more disguised than that. It's far more indirect. It might be a statement like, my family would be better off without me, or my team would be better off without me, or I'm just a burden on everybody's plate. Those kinds of statements are suicidal kinds of communications. We need to pay attention to those just as much as we do those direct statements that do happen, just not as frequently. So anybody communicating their intent is a number one warning sign. Now, the second and equally important warning sign has to do with looking for a way to die. We know that those people who died by suicide looked for a way to die. They might have searched online for methods on how to take their life. They might have gone around their house and looked for whether it was a weapon or with something sharp or a rope or a place where they could do this. They might have looked for medicines that they could take, all different kinds of ways to die by suicide, of course, but they somehow searched out and looked for a way to die. So if we have any idea, any inclination, any observation of somebody communicating their intent and looking for a way to die, those are the two primary warning signs. The next set of warning signs that we really want people to pay attention to are statements. Statements that somebody might make, such as, I feel like I'm just a burden. There's no hope for me anymore. I don't really have a future in front of me. There's no purpose for me to be around any longer. I feel really trapped by everything, and there's no way out. These kinds of statements, combined with some of those risk factors, not having enough protective factors, maybe a mental health issue, maybe some other problems in their life, that's when we know that these warning signs really, really set off a triggering set of events. Those are the kinds of things we really want people to pay attention to when it comes to warning signs.
Okay, so one of the other things that I wanted to get your thoughts on is that oftentimes, there are changes during our life or physical disorders that could cause depression or can cause changes in our behavior that, can lead to suicide. I know, like in the teens, there's a lot of hormonal changes that can happen, even later in life. And then, physical disorders like thyroid disease that can also trigger depression or anxiety, heart disease. And so people should also consider that if they're going through something physically, a physical change, that it could also affect their mental health.
I should bring you on the speaking circuit and you could talk to doctors and hospitals, because that is absolutely true. And one of the main things that's missed, not just by the general public, but by primary care physicians, nurses that are in clinics and in hospitals, is that we don't recognize often enough, quick enough, or in ways that we should be asking about are medical conditions that can impact on our mental health. And you mentioned a lot of them. And they were all right. Let me just add another one. Post-traumatic stress disorder after you've experienced a trauma. And it could be a recent trauma. It could be a trauma that happened many years ago. We have postpartum depression that happens for some women. So we have a number of these different kinds of things that happen to us biologically that are either related to a medicine that we might be taking that's a prescribed medication. For example, there are many medications that are prescribed that are steroids, and they mimic different kinds of mental health issues. There are other medications, as you were talking about, a thyroid problem that can either cause depression or other mental health kinds of behaviors. So we have to really, really pay attention to that as family members, as caregivers, as friends, as coworkers, and definitely as medical professionals, that there are these things that happen to us internally that can really affect our mental status.
Mm-hmm. So once we start to hear warning signs and little, behaviors of somebody that we feel is a suicide risk, what are some of the things that we can do to help those people or to guide them in the right direction?
So there's some simple things that everybody can do, because we know that for about half of the people that make a final decision that they want to die by suicide and they carry it out or carry out the act or attempt at suicide, it's less than 10 minutes. That means it doesn't even matter if you live in New York City. Not enough time to get to a doctor, not enough time to get to a hospital. What that means is that everybody has to know some of these warning signs, and everybody's got to be able to do a few things. So first thing is we need to know that it's okay to ask about suicide. Most people still are very afraid to ask about suicide. They think that if they ask about it, it's going to lead somebody down that path, or it's going to make them want to do it more, or it's going to put an idea in their head that wasn't there before. We have a wealth of data and research that tells us that isn't true. And in fact, the opposite can be true. If you ask somebody who might be thinking about suicide, you can actually reduce their level of distress. You can reduce their level of anxiety. So we need to know that it is okay to ask, and we need to know how to ask the question. So that's the second thing. If you're worried about somebody, if you're concerned, if you have a gut feeling that something isn't right, there's been a change in behavior, there's been a change in things that they're saying, there's just a change in their character, and you're worried about it, and you decide you're going to ask about it, that's a good thing. You must ask the question with a fatality component to it. So let me back up. That's really important, but I got to back up 1 second here.
Mm-hmm.
If you're just not sure what's going on, if you just think something might be going on, but you're not sure exactly what it is, you're not really concerned yet about it being suicide, it's okay to start a conversation with somebody. How are you doing? It doesn't seem like you've been yourself lately. Are there things going on that are really troubling you? Are you really struggling through? You can ask these kind of more broad questions just to kind of see where their mental health and what their thinking is at, their emotions. That's okay. But let's go back now. If you are concerned that somebody really might be at risk of suicide, they have those risk factors, they don't have protective factors, they have warning signs. Just as you said, we've got to ask the question, and it's got to be very direct. In doing so, we've got to make sure that we say something about death or dying in that statement. And the reason for that is if somebody's actually thinking about death or dying by their own hand, we don't ask about that, we're going to miss where their brain is at. We've got to be really clear with them. Is this what you're thinking? Would you just rather be dead? Do you don't want to live any longer? You just don't like life anymore? That's okay, as long as we get that kind of end piece to that question in there. Okay, so now that you've asked, the next thing is to listen. And we need to make sure that when we're listening to people, we spend more time listening than we do talking. I know I'm talking a lot, but we need to listen more. We need to listen for things like, do they think about the future? Do they have any hope for the future or hope for getting better? Have they ever been in treatment before? Has it ever worked for them before or not? Were they compliant with treatment, taking their meds or seeing their doctors? All of those kinds of things. We need to listen for, do they have specific reasons to live? Like, I want to get to this graduation, or I want to see my kids have children, or I want to get to my wedding date or my retirement, whatever it is. Because those specific reasons to live are the kinds of things that we can actually use to have a conversation with them. And that can de-escalate people very quickly. We want to make sure that we're listening non-judgmentally. We don't want to judge somebody who's thinking about suicide or is even struggling with mental health issues. Whatever their thoughts are, whatever their feelings are, they're theirs. And we need to acknowledge them and recognize them and say, look, I may not understand what you're going through. I may not be able to feel what you're feeling right now. But that doesn't mean I don't care, and it doesn't mean I can't support you, and it doesn't mean I don't want to be here for you, because I do. So we want to listen for specific things. We want to make sure that we reflect that back to them, and then we want to respond to them. We want to make sure that they know that we're going to be there to support them. We want to make sure that they know that there's resources out there, the ones that you mentioned, the ones that are on your website. Those are the kinds of things we want to give to somebody who has that tunnel vision, that doesn't know that there are alternatives and options. The more we can give that to someone who's struggling, the more they're going to believe in us, and the more that they're going to want to have a conversation with us. Now, one more thing that's really, really important here. If you're having a conversation with someone and they're really struggling, and they may say, I've thought about it. I wouldn't ever do it, but I've thought about it. And they're talking about suicide, make sure you don't leave them alone. We know that if you leave somebody alone that just discloses this, and you say, okay, this is really important, you and I need to talk about this, let's meet in an hour, let's meet in 2 hours. Tragically, sometimes that 2 hours is too late. And it increases their shame around this when you put that off. If somebody's talking to you about a life or death kind of thing, it's no different than if they're having a heart attack. You don't say, I'm going to get back to you and perform CPR in a couple hours, or I'm going to get you to a doctor in a couple hours. We shouldn't do that here either. We need to be ready to say, look, if that's what you're thinking about, we need to talk to somebody else right now. Let's get you to a professional. Let's talk to somebody at the National Lifeline. Let's get you connected to somebody. I'm not going to leave you alone until we know that everything's going to be safe. Those are really important things to do if you know somebody's at risk of suicide.
Yeah, and I want people to know too that it may not even be a loved one that has care and compassion for you. It could be somebody in a support group. Um, because there are people out there that feel like they don't have anyone, that they can depend on. But people do care out there. And I do think that those questions show care and compassion. Oftentimes, just that feeling can help somebody really rethink ending their life. And the other thing is depression as an example. I mean, other mood disorders as well. Um, One of the symptoms, it can be fixating on suicide as part of the disorder.
Correct.
So if somebody is going through that and is scared that they're thinking this way, it's part of just the disorder. So once that's you're back into balance, you may not have those thoughts anymore. Uh,
Correct. That's exactly right. There are a number of symptoms of these various illnesses. Obviously, most people think about depression, and depression obviously has a depressed mood where you're unhappy and you're very sad. You might be very tearful. You might have physical symptoms such as you don't want to eat, or you eat too much, or your sleep is off. Either you sleep too much or too little, or it's very distressed kind of sleep. You might have no energy. You might have no drive, no interest in anything any longer. You might not enjoy anything longer, but you're exactly right. Some people that live with depression do think about suicide. It is one of the symptoms of it. Not everybody does, but some people do. So we need to make sure that when we're talking to somebody who's in any way struggling with a mental health issue, we want to check things out. We want to make sure we're asking the right questions and keeping people safe and getting them through the crisis. And most of the time, it is true that anybody can be a support system. You can find things online, you can find support groups, you can find safety apps that you can plug into your phone. There are lots of resources that are available to you, whether you have somebody right next door to you, whether you have somebody down the street or on the other side of the world, that will connect with you.
Well, one thing that Sean mentioned when he lost his brother Eugene to suicide was that I'm sure there's like an aftermath of emotions that come with that, along with, of course, incredible grief. There could be guilt or remorse. I could have done something. And he mentioned that he went through grief counseling. Um, can you tell me more about grief counseling and maybe what you could say to somebody, if they're feeling any grief, any guilt or remorse about losing a loved one to suicide?
Yeah, so this is one of those really kind of tricky and sensitive things. All in our country, we don't deal with death very well. We don't really prepare people for it. We don't do a lot to support people through it. There's lots of stereotypes out there about death and dying that you have this grieving period that's kind of an active grieving period for maybe a week, couple weeks, maybe a month at the most, and then yes, you grieve with your family for maybe a year, but then it's time to move on. That's really kind of pretty standard thought for most people. And yet we know when it comes to suicide, there are some things that are similar in that and some things that are very dissimilar in that. Suicide occurs most often in the homes. It doesn't most often occur in hospitals, as most deaths do. Suicide involves a violent act and can be very traumatic to see, which is not something that most people experience when they experience seeing somebody who's dead and deceased. There's lots of unfinished kinds of unresolved things that happen that don't necessarily happen with other kinds of death. It can be very sudden and unexpected, as opposed to some other deaths that people know might happen. So there's similarities and differences there. The main difference is for people grieving a loss of a loved one to suicide, and I have personally experienced this. I lost 5 patients of mine to suicide when I saw patients on a regular basis. I lost a cousin of mine. I lost a very close friend of mine to suicide from the time we were a year old till we were in college. So I kind of know this from a lot of different perspectives, as well as from a professional and clinical perspective. When it comes to suicide, there is this unending why that other deaths don't have. And suicide loss survivors live with this why that doesn't ever go away. Coupled with that is, as you mentioned, guilt and shame. There isn't guilt in other types of death, but for suicide, guilt around how come they didn't call me? How come they didn't reach out to me? Was there something I did before that prevented that? They tried to call me and it was the middle of the night and I just figured I'd get back to them in the morning, but I had no idea this was going to happen. The last conversation we had didn't go very well. Is it my fault that they decided to die? All of these things are reactions, responses, emotions, feelings that come about after a suicide loss that in grief counseling, we try to help people through and help them understand about suicide and how different it is. There's also varying things around the relationship that you had with the person who died by suicide. For example, a grandparent that loses a grandchild to suicide is grieving the loss of a grandchild, plus they're grieving for their child that lost a child. Mm-hmm. A spouse that lost someone to suicide, they fear that nobody else will ever want to be involved in a relationship with them because of what happened to them. They're afraid for their children now, that their child might become mentally ill or might die by suicide as well. If you're a child that's lost a parent to suicide, children often feel it's their fault, it's their responsibility that their parent died by suicide. They become overly responsible for their other siblings. So there's all these different things that take place when we've had somebody die by suicide that grief counseling needs to address and help somebody work through.
Well, Sean mentioned that after his brother died, that he sort of went through a period where he wanted to shut down those emotions, which is so difficult to deal with. But he used drugs and alcohol, which of course got him into trouble with drugs and alcohol. But with the counseling, it's like a healthy way to get those feelings and emotions out, and doing it in a way which, hopefully we can get beyond some of the grief and, kind of get back to life and have a healthier perspective on a really terrible loss.
Yep, and sometimes people don't have access to therapy because their insurance or because they live in a remote area. Males tend not to be willing to talk and be open as we would like them to and need them to be when they're grieving. So yes, we do see people turn to alcohol and prescription meds to get through the pain of a suicide. So, what happened to Sean and with his brother is a horrible tragedy that has taken Sean in different directions, not only personally but professionally, obviously, with the band, with the music that he's written, with the concert and the event that he started, the movement that he's become involved with, and he's tried to take a really, really horrible tragedy and turn it into something positive. And that's not positive that his brother is gone, because he would do anything. He'd give it all up to have his brother back. But he wants to turn it to a positive so that nobody else has to suffer the way that he suffered. He doesn't want Sean's a really incredible guy, and he has this incredibly huge heart. And he wants people to be well, and he wants people to know that they don't have to go through this alone. And so by creating the Rise Above Festival, by writing his music about this, by supporting fans that reach out to him all of the time with their personal stories or that he meets while he's on tour, this is how Sean has found a way through some of the grief. But the truth is, and I'm sure he told you this, it never goes away. And it's always there for him. It's tattooed on his hands. It is part of who Sean is now, and it is really this legacy that he is leaving in his brother's memory that has become this really huge worldwide phenomenon called the Rise Above Fest. That and the song Rise Above is an anthem for suicide prevention and saving lives.
I love that song. It's one of my favorite Seether songs. It's got so much heart to it and so much emotion, and just, you could really feel, um, just the words coming through to you
Uh,
when you listen to that great song.
it is my favorite Seether song. I
Hmm.
tear up every time I hear that song live or I hear it through my computer, um, because I know what's behind it, and what's behind it is Sean and the loss of his brother, and how hard that's been on him, uh, to not get to have his brother in his life any longer, and to think about, could he have done something different? I wish something else would have happened, and how that lingers for Sean. It doesn't mean that Sean hasn't gone on and continued to function in his life, and that's a really important message that we want everybody to know, that that life does continue on. It's hard. Suicide grief doesn't go away; it changes over time. But Sean is a really great example of how you can survive through the worst horrible experience in your life of losing someone that close to you in this way, and get others to support you, his band members, his management, his crew, um, and friends, and partner with an organization like Save to say, look, um, this is horrible. This just sucks what happened to me. I don't want it to happen to anybody else. And if I can do one thing to inspire somebody to say, I'm going to reach out for help, that's what I want to do with my pain. And he's done that better than anybody else in the industry.
Yeah, it's true words, true words. So, Dr. Dan, uh, thank you so much for talking to us about suicide prevention. Is there anything else that you would like to say about save.org or about suicide prevention?
Sure, and again, thank you for having me, and thank you for Check Your Head podcast, and interviewing all the people that you do, because they are influencers. They're champions for us out there. They're the people that the fans and the public want to hear from. So if we can get them to talk about this and get them to be a part of this, get them to come on board with Sean and his mission, we're going to save lives. And all the bands that have played have been a part of that. We're eternally grateful for Seether and the band and Sean's leadership, and all the bands that have played over the years at Rise Above Fest, and even at the recent Exit 111 festival. Um, I guess the one thing that I'd want people to leave with is know um, that suicide's preventable. Now, we may not be able to prevent every single suicide. We can't prevent every heart attack or every person that dies from any other disease. But we know that suicide's a preventable death. And if we can all be involved in this, if we can all kind of get over that stigma and shame and those negative words that are attributed to mental health issues, and we can be honest and compassionate with those that are out there that might be struggling, they're going to open up to us. And if they open up to us, it's an opportunity to save a life. And anytime we can do that, make that connection and save somebody's life, we know it has ripple effects, not just for that person and their family and their work or their school, their friends, their community, the world. It changes the world when somebody stays alive through a really horrible, horrible crisis that they might be in. And that all just takes a little bit of time and a little bit of compassion and a little bit of willingness to stand up and say, I'm going to be there for you. And we have people like Sean that have done that and said, I want to do this in a big way. And the more people that we can get to come on board with that, the more lives we're going to save. In the time we've been talking, we've lost 3 or 4 people to suicide just in the time we've been talking. So we all have a part in this, and we all have an opportunity to save lives. And you're doing this and bringing this to light really does make a difference. And so I'm grateful for you and your words and the Check Your Head podcast. And I hope everybody that's out there hears this says, you know, if I can do one thing and save somebody's life today, I'm going to do that.
Thank you so much, Dr. Dan. That's Dr. Daniel Reidenberg of the Save.org organization. Stands for Suicide Awareness, Voices of Education. If you'd like more information, go to save.org or go to checkyourheadpodcast.com, where we also have a listing for save.org and the Suicide Prevention Lifeline, along with other information on mood disorders and what you can do. Thank you so much, Dr. Dan.
Thank you.
Hi, I'm Mari Fong, producer and host for Check Your Head, Mental Health for Musicians podcast, where musicians and experts come and share their stories and solutions for mental health and wellness. If you enjoyed this video, please subscribe to our YouTube channel. And if you like us, please follow us on social media at Check Your Head Podcast. And visit us at checkyourheadpodcast.com, where you'll find over 100 mental health resources that will assist you in your mental health recovery. Also, if you want to show your love, you can donate or buy the merch. We have superhero tees and hoodies for sale to remind you and your loved ones that you are superheroes every day. You rock, and we love you.